Section 3. Sleep. We don't know exactly why we need to sleep, but we do know that it's absolutely essential. As newborns, we start out sleeping close to 16 or 17 hours per day, although as any exhausted new parent will tell you, these hours are definitely not consecutive. By 6 months, they start sleeping mostly at night, with some naps throughout the day. Infants also spend a lot more time in REM sleep compared to adults. This might be a clue about the role of sleep in brain maturation and memory consolidation. The biggest sleep-related concern in infancy is SIDS, or sudden infant death syndrome. SIDS occurs when infants stop breathing, usually during the night, and die suddenly without apparent cause. The risk for this is highest at 2 to 4 months old, and SIDS is the highest cause of infant death in the United States. The American Academy of Pediatrics recommends that infants be placed to sleep on their backs to reduce the risk. This increases access to fresh air and reduces the chances of overheating. Of the numerous other risk factors, those that present the highest risk are maternal smoking and bed sharing. If you want to sleep next to your baby without increasing the risk of SIDS, a bassinet or co-sleeper on the side of the bed is a good option. Experts recommend that young children get 11 to 13 hours of sleep each night. Usually this consists of a long period of sleep throughout the night with one daytime nap. Preschool children who get more sleep are more likely to have better peer acceptance, social skills, and vocabulary. More screen time is associated with a decrease in sleep time, and sleep deprivation appears linked to attention deficit hyperactivity disorder. Unfortunately, many children aren't getting the full amount of sleep that they need. More than 40% of children may experience a sleep problem at some point, and chronic sleep disorders can result in impaired brain development. Adolescents in the US and in other countries are not getting adequate sleep either. 8 hours or less is inadequate. With the opportunity to sleep as long as they like, though, most will get an average of almost 9.5 hours. Getting too little sleep is linked with a number of problems, including struggles with academics and sustained attention, more school absences, more emotional and peer-related problems, higher anxiety, substance abuse, and behavioral disorders. Some factors in sleep deprivation among adolescents and older adults include electronic media use and caffeine intake. And some research suggests a hormonal phase shift may also be contributing. Adolescents seem to experience a shift in their circadian rhythm, their natural sleep-wake cycle, which makes them naturally fall asleep later and wake up later. Unfortunately, many high school classes start very early in the morning, cutting short the adolescent sleep time. Very few high schoolers get the amount of sleep that their bodies require. Like adolescents, many adults don't get enough sleep. The average American adult gets just under 7 hours per night, which is not enough. As individuals age, they appear to engage in more light sleep and less deep sleep. So it's not just the quantity of sleep, but also the quality that can be problematic. This can have real consequences, including increased susceptibility to disease, a shortened lifespan, and impaired cognitive and motor skills. Cognitive functioning can be impaired by both too little sleep and too much, less than 7 hours or more than 9. So you really just want to hit that sweet spot of somewhere in between 7 and 9 hours.